I understand that the asthma rates in your district are among the highest, or possibly the highest, and especially for children in the country.
It is. My district is a very challenged one when you look at the health realities. We are one of the highest areas with asthma rates among young people hospitalized. We also are the epicenter of the diabetes epidemic.
Are they related?
Not that I'm aware of, but it just really just paints kind of the challenge that my district has with a lot of health, the disparities that exist, and then the health challenges. But with regards to asthma specifically, yes, we have one of the highest incidences between that East Harlem portion of my district and that South Bronx portion of my district.
What have you been able to do? This is you're in your second term as a councilwoman representing the district. What have you been able to do legislatively to address this problem with asthma and related illnesses?
Well, there's so many different aspects of it. One, obviously, is that we recently passed, in the last term, but we recently did pass the idling laws to really minimize the amount of time that people can idle their cars, particularly that is of concern around maybe schoolyards and school areas. We are talking right now, there has been a bill that has been introduced that what we also find is that within the home, there may be triggers that really trigger asthma and asthma attacks. And so we are looking at increasing penalties to landlords that are not providing repairs. And those repairs may actually, the state of the apartment may be contributing to really creating an adverse impact, an adverse environment for families and for children. We have really focused a lot of money and attention in terms of initiatives that we've sponsored in the leadership of the council and our speaker to really talk about things that we can do within communities and giving nonprofits the resources available to do more educational campaigns and to really educate families on what those triggers are and in what ways they can really help create a more positive environment within the home in areas that they can control. There are clearly things outside that we can't control or we have a harder time controlling. But congestion, traffic, pollution, and those are things that really we are challenged by. East Harlem and leading up to the Bronx, we've got the FDR Drive. We've got a lot of bridges, and so that all those obviously brings in a lot of traffic to the community. And so there was the discussion that we had a year ago, about congestion pricing as a way of trying to minimize the number of cars.
I want to talk to you a little bit about what's affected by the cuts because of the very large deficit that New York City faces, indeed the state even more deficit. We'll talk a little bit later about your view about cuts and what should be cut and what should be done to solve this deficit. But more specifically, one of the things that is threatened is senior centers. And that comes on the heels of a plan by the mayor to overhaul senior centers, and that's been something that you've been concerned about. Tell us a little bit briefly about that plan, why you're opposed to it, and then what the impact might be of these cuts, that if in fact as many as 75 senior centers are cut.
Right. I mean, we're just obviously in such a difficult time. We know that at this point we still don't have a state budget, and the state budget that we were working with was the proposed budget that the governor presented many months ago. That's what we had to use as a city to guide us in the mayor presenting his executive budget.
Because the city depends so much on state funds as well.
Correct.
Yes.
There is so the executive budget that the mayor presented was looking at that reality of $1.3 billion less aid from the state of New York. And so that was obviously, that's very dire, that's very serious. And that's where we heard about the 50 senior centers being cut, fire companies being closed down, daycare centers being closed down, less teachers in the classroom. I mean, a very dire situation that for a city of 8 million and so dense, that concerns me with regards to the quality of life and where we're heading. So with regards to the aging department in particular, in my district, out of the 50 senior centers that were being discussed, I have 4 that are being slated for closure. My colleague Inez Dickens has 7. I mean, we're really looking at the numbers and really thinking that it's a little bit disproportionate with regards to the numbers that we're seeing. It's very high. So we're going to look at that and whether I have great confidence in the existing commissioner, Lilian Barrios Paoli. I think she's been incredible. She's very open to dialogue and to hearing perspectives. So we want to have a conversation about whether those centers that have been slated for closing, maybe there's different options and different ways that we can minimize the impact on particular communities. So that's one thing. Last year, the senior center, the mayor did present a plan that would have closed additional centers and would have restructured the system. And that was very much opposed by us because there was not a lot of opportunity for the community at large to inform the process. It was kind of a very much a heavy top-down decision, the way it was being approached. So we had real concerns about it. We came together as a council under the leadership of the Aging Committee Chair and our Speaker, and we were able to have the city shelf that proposal. And
Shelf it's out of
put it on hold.
Oh, okay,
and
it's on hold.
resume the conversations in a different way. So what we've been having from the Department for the Aging is that they've been going through a whole series of town hall meetings, conversations with advocates, with users of senior centers, and they are going to restructure them, but now the process is being informed by the community that is using the centers in a way that it's taking us in a very different direction than what it was originally proposed.